practices, especially female genital mutilation and cutting and child marriage. You are an advocate at the High Court in Kenya. You previously worked for the African Commission on Human and People's Rights. You believe that advocacy for gender equality is a way of life. It is about what we do in our private spaces, which then transcend to the public space. Brima Balo, you are in charge of you're a program officer at AMZOP, the Malian Association for the Monitoring and Orientation of Traditional Practices. You have a university diploma in educational psychology and sociology, and you wrote your dissertation on the sexual and reproductive health of young people and adolescents in Mali. You are a specialist in child protection issues and the fight against female genital mutilation, child marriage, and gender-based violence. Julia Lehmann, you're senior manager on SRHR, sexual and reproductive health rights, and gender transformative programming with Plan International in Denmark. As a social anthropologist by training, you are a rights-based development professional specializing in SSR, HR, and gender transformative programming. You've joined Plan International in 2009 and have lived in West Africa for the past 10 years. You have supported projects and programs to end FGM in various countries, particularly in Mali, and you have helped to strengthen local partnerships and influence policymakers and donors. Oumou Salif Touré, you are a coordinator for Global Media Campaign. Your activism goes back to your teenage years when you experienced a sexist education and discriminatory situations. Your revolt made you aware of the notion of gender, and your desire to change things led you to join the network of young feminists of West Africa, which you represented at the Génération Égalité Forum in Paris. You are the focal point of the consortium of young people against female genital mutilation in Mali and have been selected for the prestigious Personnalité d'Avenir program of the French Embassy. Thank you so much to you all for joining us today for this webinar. Now, I wish to introduce my colleague Shannon to you, who will present the main findings of a report. So she will do it in English, and for French speakers, you need to switch to the French interpretation function for the duration of the presentation.
Good morning, good afternoon, good evening, depending on where in the world you're joining us from. My name is Shannon Thompson, and I am a researcher with Orchid Project. So I have the privilege of being able to share the key findings from the report that we are launching today. So let me just share my screen so that you can see my slides, and then we can get started. Can everyone see that okay? Great. Great. So just in summary, I will be presenting on first how our report was compiled, and then looking at what is happening in an overall sense with FGMC in Mali, looking at what the data is telling us, what some of the key drivers seem to be, and then framing some of the questions for how we can move forward, which we'll move into within the panel discussion. We have, as Anne has introduced, an amazing panel of guests with us today, and are so looking forward to being able to explore this issue in more detail with their insight. So first, just to share with you how we compiled our report. This is a country profile update report, which is building on a report that was written in 2014. So the first step was to take a bird's eye view and to look at an overview of changes in the political context, academic literature, as well as gray literature on gender and social norms, as well as looking at some changes in national statistics and progress towards the Sustainable Development Goals. From there, we took a more zoomed in approach to look at trends in FGMC practice and prevalence. And to do that, we conducted a comparative analysis of data collected by the DHS and MIX between 1995 and 2018. We had the opportunity to speak with a few grassroots activists, NGOs who are implementing in the country, as well as some community-based organizations to test out some of our assumptions and findings, and to come to a place where we can present those now. So I'll begin with just going through a few of the headlines, and then we'll come to some of the discussion questions at the end. So one of the overarching areas that in our report is around the population in Mali has doubled or almost doubled in the last 20 years, from 11 million to almost 21 million. And at the same time, the prevalence is not changing significantly. So from 2001 was 91.6%, 2018 was to 88.6%. So what we can see is that if the population has doubled and the prevalence has stayed the same, then the number of girls affected by FGMC in Mali has also doubled. So we estimate that 4 million girls have been cut between 2002 and 2022. The map of prevalence within Mali shows distinct variations by region. However, these variations are heavily influenced by the ethnic groups that predominantly live there. In the northeastern regions of Kidal and Gao, the prevalence rate is almost 0%. And down in the southern regions where ethnic groups who traditionally practice FGMC are predominantly located, the prevalence rates are above 90%. What we can see in terms of type of cutting is that there have been some reported changes. It appears that there is a decrease in cut flesh removed type of cutting, a decrease in cut flesh removed and an increase in cut no flesh removed. However, at the same time, there is also an increase in the percentage of women who don't know what type of cutting they've had. So this change and shifting in the types of cutting may actually just be a redistribution rather than an actual change in type. Similarly, you can see an increase in women who report that they have been sewn closed between 2001 and 2018. However, this may be the result of differences in how the questions were asked between the different surveys. However, what we can see is that the age of cutting is lowering. There's been a statistically significant drop in age of cutting between 1995 and 2018. 75.5% of girls between the age of 0 and 14 are cut before the age of 5. However, in 1995-1996 DHS, the average age of cutting was just below 4.5 years. And in the 2018, the average age of cutting was just below 2.5 years. So from these areas, we can see that there are a few key drivers within the practice and within this context. One of the main things to be aware of is that there is no law in place against FGMC in Mali, and that's largely because the legislation has been blocked by religious leaders. Other factors such as urban or rural residents, socioeconomic status or wealth quintile, or even level of education don't have a significant influence on FGMC prevalence. However, as we mentioned, ethnic group and ethnic ties do have a stronger influence. 70% of women and 68% of men believe that FGMC is a religious requirement. And a majority, 75.8% of women and 74.4% of men believe that the practice should continue. So we feel that this speaks to a critical driver in Mali of social norms around FGMC that are reinforced by religious beliefs. And it leads us to the question of how to engage with social norms that are constructed or reinforced by certain religious beliefs, and how to work towards creating shifts in those areas. So some of the questions that we want to explore within this webinar are helping us to shape a way forward. So wanting to first frame our discussion in understanding some of the challenges that these religiously reinforced social norms create within this context. And then to start to look at successes. So where have there been successes in engaging with religious leaders, engaging in shifting these religiously reinforced social norms? What are some of the barriers to change? And then what are some of the strategies that we can explore that will help us to see how we can move forward with both advocacy and programming within Mali? So thank you so much for your attention to this presentation and your time. I just want to remind you that there will be a panel discussion that's coming up next, and then a Q&A session. So if you do have questions that you want to raise in the Q&A session, you can feel free to add them into the Q&A box at any time. So thank you so much, and I will pass back to Anne to take us forward with the panel discussion.
Merci Shannon pour cette présentation limpide. Alors, pour résumer,
thank you, Channel, for this presentation. In order to summarize this report, the report highlights two determinants. So for conviction that excision is a religious necessity and the lack of a legislative or framework. We have addressed the four. We are now going to address the four questions. Now, from your perspective, what are the challenges that some religious ideas pose to the eradication of excision? And Caroline, I was going to start with you. In April 2021, Equality Now associated with AMSOP to file a complaint with the ECOWAS Court of Justice, which is not trivial. Yes, you can say that again. You are asking the Malian government to adopt an anti-MGFC law, and you claim that not doing so puts the country in violation of the Maputo Protocol and ECOWAS. Yet, the Malian government has been trying for 20 years to pass this law. So why hasn't this law been passed yet, and why do you feel we need to go to the court? Caroline?
Yes.
Can you hear me?
Yes, I can hear you. Can you hear me?
Yes, I can. Thank you.
Okay, thank you. Thank you so much for the question. So maybe let me start with the last question that the statements that you said that the Malian government has been trying for 20 years to pass a law against FGM. Yes, if we say trying, like including...
Disons essayer, c'est-à-dire inclure des dispositions qui interdisent la FMG.
For us, we feel like it's not enough effort, because what has happened is that it was inserted in the GBV bill, gender-based violence bill, but then again, because they felt that there was a possibility that this bill will not pass in Parliament, it was removed from that bill. And then we've also, we know that the Malian government also created a national committee on ending FGM, but later on, the mandate of that committee was expanded to be gender-based violence. So these are the small things that we feel that it doesn't show enough commitment, enough political commitment from the government of Mali to end FGM. And also taking into consideration the fact that the committee was not well funded, and also a lot of the capacity building and community awareness that we're seeing in the country is mostly from the efforts of civil society organizations. So the government is not really investing a lot more in that. So that's why we feel that there wasn't enough effort from the government to pass a law against FGM.
Les chefs religieux ont aussi bloqué plusieurs fois les projets de loi.
Yes, I mean, if it was blocked, they could have tried to find out and also try to do more capacity building with the religious leaders, engaging them more. But this engagement of the religious leaders is mostly coming from the civil society organizations and not mostly from the government. That is the issue that we have. And then the reason why we decided to file the law is that governments under international human rights law, governments have an obligation to respect, protect, and promote human rights in their countries. So the aspect of promotion is now where we see capacity, awareness raising, all that. And then protection. Laws are a form of protection, because when you prohibit an action in law, it means that you're setting the standard that this is unacceptable in the country, and in a way you're providing protection for girls and women against in this case, since we're talking about FGM, against FGM. So because there's no law prohibiting FGM in the country, and so there's no protection.
But is there a draft? Is there a draft being prepared? Is there another draft being prepared?
We understand.
Are the religious leaders engaged in that draft at all?
So we understand, we have heard that there is an amendment to the penal code, which is the criminal law, but we have not seen that yet. So I cannot say for sure that there is it's actually prohibited within the law, but we have heard that there is such an amendment taking place. As to whether religious leaders have been involved, I cannot speak to that yet, because I am not sure to what extent they have been involved, and also to what extent civil society organizations have been involved in the process of preparing this amendment to the penal code.
Merci, Caroline. Julia, Plan International au Mali a
Julia.
priorité de protéger les enfants contre les pratiques préjudiciables.
So, Plan International in Mali has the objective that the Plan International in Mali works to protect children from harmful practices and increase their ability to.
Comment est-ce que cette croyance affecte votre action auprès des enfants? Et comment les adolescents
And 70% of women and 68% of men in Mali believe that cutting is a religious necessity. How does this belief affect your work, and how do children, young adolescents, react to messages about their sexual health on the one hand and pro-MGF religious belief on the other hand? And how do you integrate dialogue with religious leaders into your programs? Thank you for these questions. It's true that we're working on the reproductive sexual health with youth in Mali. There is a tension among different messages that are sent, because more and more we are focusing on issues related to rights in whatever we do regarding sexual and reproductive health. It's not only biological or medical aspect, but is things related to human rights and gender aspect. And this allows opportunity to initiate or promote a reflection regarding certain practices or traditional or religious practices. And at the end of the day, it is a tension that is created between this new information that we're bringing and the information from other sources that make young other people think. It's a process that we're trying to support, but also we also accept that the youth and adults need to engage in this reflection process and arrive at their own conclusion, and how we can reconcile these two aspects and two messages of time. Maybe not now. It may create or lead to a change in attitude, and then people will start saying that it's not the religious aspect that needs to be taken into account, because the negative aspects are so dangerous. Now, Are you able to engage a dialogue with religious leaders? Are you able to reconcile both of them in your approach? Or is it difficult for you to do so? It all depends. It's not always easy, that's for sure. But among religious leaders, they are not all the same. Some are more conservative, are more rigid, others are more progressive, and we have a good experience with leaders that are more open, maybe to new ideas, to self-questioning, or and it is with such leaders that we're working mostly, but also taking relying on their influence on other religious leaders who are easy to convince. So it is up to them to share with other leaders and continue discussions and find arguments theological or religious arguments that can convince them. Yeah, find religious arguments. This is a way in which you can engage a dialogue and address the challenge, which is Brahima. Amzorp works in 252 villages in Kais, 80 in Kulikoro, 20 in Doyolia, and 15 in Buguni, where the prevalence of FGMC is the highest. You evolve social norms towards declaration of abandonment at the village level, and you engage in dialogue with cultural and religious leaders in your programming.
À votre avis et d'après votre
In your
expérience,
opinion, and based on your experience with abandonment campaign, how does religion influence beliefs about FGMC at the individual level?
Okay, merci. Donc, on m'entend?
Thank you. Yeah, can you hear me? Yes, we can hear you very well. I really subscribe to the point of view shared by my predecessors who have presented the situation of excision in Mali or cutting in Mali. I wish to thank the chair, which has carried out a brief summary, which has presented, who has presented a brief summary which is relevant on the fight against FGM in communities. We're working in areas where the social cultural context is in progress, is progressively changing. In the beginning, religious leaders, especially the Muslims, considered our action to be something Western. Now I'll speak the condition, saying that the Western countries may be Islamophobic and would like to destroy the African culture. So don't be astonished of the increase of religious integrism in Mali. So in the beginning, right from the beginning, the dialogue is difficult. However, with communication on behavior change, we are still standing, and we associate women, men, community leaders to our discussions. And at the same time, we also seek to integrate the transformative approach to gender. So, and de facto, we have the support of some religious leader, and now the narrative has started changing. We are presenting excision or cutting as a practice that is harmful to health, human health, and that is harmful to, which violates the human rights of women and young girls. So in our narrative or discourse, we take into account the fact that no religion is backing human suffering. No religion is working for human health degradation. All religions should defend human dignity.
Donc, c'est dans ce cas,
So that is in
nous avons discuté avec
that context that we have discussed with religious leaders who have followed suit.
sont des hommes modèles,
And some of them are models
souvent de village en village.
that go from villages to villages to raise awareness and who preach in villages and in mosques. So the need to take into account the religious discourse and engage dialogue with the religious leaders and to meet with them in mosques and bring them in villages as well.
Le travail de Global Media Campaign est très différent.
The work
Vous
of the Global Media Campaign is very different. You train activists to lead powerful campaigns against FGM, in which influential people such as religious leaders and doctors speak out in the media to condemn the practice. As we were preparing this webinar, you were talking of success stories from religious leaders, but also the gap between what the religious leaders say and what they do. In your opinion, why is it important to make religious leaders take the floor on media, and what difficulties are you confronted to regarding this aspect? Thank you, Sophie. So with religious leaders, we have really involved in our collaboration.
Aux actions que nous
At
menons.
the beginning, it wasn't easy to have them join the action we are carrying out on the ground or in our programs. But now I think we have really improved the partnership level, and we are trying to
Également dans les argumentaires qui sont avancés, on est
in our
arrivé à une
discussion,
conclusion entre nous qui
and we have reached the conclusion where
ne sont pas une obligation
FGM are not a religious obligation. We've reached that conclusion because we have been able to work with them 3 or 3 times on great conferences that were held in Bamako and to which they were invited. And we have pursued the fight on the radio. And those campaigns are not only done with the youth.
We engage with all stakeholders, journalists, doctors, religious leaders, and we talk about female genital mutilations. And we know that this is a very difficult situation for them because what they say on air, on TV, on radio station is very different from what we get during our meetings. Because sometimes we notice that they want to make us understand that FGMs are not so bad, or maybe that we should change the way we talk about this issue. But within GMC, we know that there is no good way to do female genital mutilations, and we really want to highlight the fact that FGMs are not a religious practice, and there is no way to do this practice. Do you think this is a vicious circle between religious beliefs, individual beliefs, and what religious leaders say? Do people believe that FGMs is a religious requirement, and when religious leaders themselves talk to community members, do you think that they are scared of what they are going to say? Maybe because I've got the feeling that there is a double standard. Yes, I think there is a little mixed up between our traditional practices and religious beliefs in Mali. This is why our work in Mali is extremely difficult. We know that not all traditional practices are good or approved by the society, and a number of cultural practices have already been abandoned. And I think we've actually merged cultural and religious beliefs. And this is why I think the influence these religious leaders have is pretty important. And this double standard is a real problem. Some people say that FGMs is not a religious requirement. And this is a pretty bold statement, especially when you are a religious leader, because you're putting yourself in a dire situation. But I've noticed that we've made a significant number of progress. Before, we were violently attacked by the audience, we were abused, verbally abused. But the more we talk with the audience, the more we notice that they ask us questions. They ask religious leaders to tell us exactly what they think of FGMs. And that's why it's very important for us to provide the public with enough information. And we need to have clear information on their stand. And I think this is also very important because we need to adopt a law against female genital mutilations and cutting. So I'm going to ask you a second question. And I think that you've drawn a pretty clear line between the challenges you faced and the successes you've had within time. And for instance, on your website, there is a whole page on the positive results you've got from your various actions with the religious leaders. Could you please give us maybe 60 decibel program that you've put up in place, and what is the impact of this program? Umu? Yeah, we've put in place a program thanks to Plan International Denmark. We've launched a massive campaign online. We've met with religious leaders, and I think this is one of our biggest successes because it was easier to talk to them, and we went to national television stations, and you know how difficult it is to go to the ORTM and talk about female genital mutilations and to have an open debate with religious leaders. It's extremely difficult. As far as the results we've got, thanks to 360 decibel, the 360 decibel program, many people listen to this podcast, to this program, and we've learned a lot. We've shared a lot of information about female genital mutilations. We can organize as many local activities as possible, but they're very limited. But when we add these programs, we can reach a lot of people and we can spread across our message at a cheaper cost. And it's also very important to include religious leaders because they clearly say that there is a clear line between female genital mutilation and religious beliefs. And each time we talk with them, they clearly say that this is not what the Quran or the Bible says in Mali. Maybe elsewhere, but in Mali, no, it doesn't exist. And the main issue we have is with Muslim religious leaders. And it's very important to invite them, to talk to them, because before it was really impossible to talk about these issues with them. And with the Muslim consortium, we have developed a better relationship. Before, they were not invited or they didn't even accept our invitations. But today, we have a better relationship. They answer to our letters, to our emails. I think we've made a significant progress when it comes to our relationships with the religious leaders, and we want to improve it further. And why not participate in the adoption of this law against FGMs? Because we want to protect young Malians' lives. And we do not want to perpetuate this harmful practice, not only in Mali, but in the ECOWAS region. And we've noticed that around this region, many countries are already against this practice. They have laws. But since they know that they are infringing the law, they come to Mali because there is a legal vacuum, a legal void. And you are talking about cross-border FGMs because we've noticed that girls from other countries come to Mali and are victim of this practice. And I think Julia also mentioned that we should talk about faith-based advocacy. And you said you wrote a book and you work with the Islam population and development. And I think it is something that's very important because in Mali, GMC and other CSOs have developed a number of measures. Umu said that it's very important to start to talk with religious leaders, and sometimes it's very limited to use ordinary measures or ordinary local activities. But in your programs, Prima, you go to the field. How do you encourage them? And I'm pretty sure that you've also noted a number of success stories. How can we apply these success stories elsewhere? Brahima, thank you. I would like to acknowledge what Umu and her organization has done. As far as what AMPOST has done, we've developed Protect the Next Generation, and we work with a French NGO, and I would like to thank them for the support. It is true that French NGOs are not really welcomed in Mali nowadays. This program, as I mentioned, is pretty successful. We've been able to share our experience with our Burkina Faso counterparts, and we work with a Burkina Faso NGO, SOS Girls and Women. This shows that when we share our best practices, we can change social norms. And if the communities accept to change FGMs, to stop MGMs, then it means that they actually understand the fact that this practice is harmful. So that's what we've done with these NGOs. That's why we work in as many villages as possible. And I will take this opportunity to thank all these NGOs which work for social norms change in the region. Thanks to the data we collect, we can convince the Malian government to understand why it's important to abandon this harmful practice. And I think Caroline mentioned the fact that the Malian government must protect and promote human rights. We've ratified all these laws. We are a member of the African Commission on Human and People's Rights, for instance. And why should we not apply all these laws and legislation? So, if I got you well, what do you think are the key factors of these success stories? I think we were able to better communicate with the communities and make them understand that it's very important to go to the hospital and see what FGMCs have done to these poor girls and women. When they have these pictures, when they understand what are the consequences of these MGMCs, it's easier for them to understand why it's a harmful practice. And it is also the opportunity to give them a second opportunity to have a better life. So these women can also talk about how they were taken care of and why the community should abandon this practice. So I think this is basically what I can say are the key factors that really helped us. I'm really happy to see that UMU is present here because we need the help of the media. Because when we communicate with local communities, it's pretty great, but we need broader communication means. Your line is a little bit breaking, Prima, but long story short, I think we got what you wanted to say. Julia, Brahima said health messages are pretty important and data as well are pretty important. When we show them clearly what are the consequences of FGMCs, they are eager to listen to these messages. Do you believe that these key messages are also important in your programs? How do you talk to religious leaders? How do you convince them to abandon FGMCs? Thank you. In Plan International, I think what is pretty important is our long-term presence on the field. That's why we have a better bond with the religious leaders and the communities. We've developed this relationship since a number of years. So it took us a lot of time and it's pretty useful nowadays. Also, I think our reputation speaks for ourselves and we have a long-term presence as far as the fight against MTMCs is concerned. So we are also involved in economic empowerment, education, important issues to the communities. So it's pretty easier for us to talk to religious leaders and the communities. People are happy to talk to us about pretty sensitive topics and not the same way they will talk to maybe CSOs or other local NGOs. And we do not necessarily want to talk about FGMCs at the beginning. And sometimes we believe that they have other bigger issues such as security, conflicts, etc. So since we have a broader agenda, it's easier for us to talk to them. Sorry, I forgot what I wanted to say. Just lost what I wanted to say. Sorry.
Non, j'ai pas dû. Si tu peux
Oui,
prendre
oui,
la
non, c'est
deuxième
oui.
partie de la question, là, ça va me
Oui, oui.
revenir.
I'll get back to it later.
Ce que vous êtes en train de nous dire, c'est que
So let me help you.
Les arguments de santé, là, c'est
Oui.
maintenant.
You were talking about health messages. Yes, indeed. So as far as health messages are concerned, we've noticed that it's a good way to talk about this topic. Recently, we've noticed that we've shared the same data, the same key findings, and we think we should examine the impact of this data. We worked in Picasso, and you've rightly said that the prevalence is the highest there. Specifically, we've noticed that many girls are victim of this harmful practice at an early age when they are barely 2 or 3 years old. And we talk to the members of these communities. We ask them, why do you do that? And most of them said the same thing. They said that they wanted to prevent further harms to these girls because they believe that when they are young or younger, they will not be traumatized, and they will heal better and faster. And we ask them if it's the best strategy, if it's what they really need to do. This is not what we wanted to convey as a message when we said that FGMs and cuttings are a harmful practice. So we want to avoid this kind of false strategies with time, and they did not really lead to the abandonment of this practice, but to other issues. Because when they use these strategies, it's very difficult to protect these girls. Because before they could speak, they could tell us what happened to them. But today they're young, they cannot speak. So what you mean is that there are more and more new factors in play. And you said that people have other priorities, the security, hunger, etc. And they believe that if they start this practice early enough, the victims will not remember anything about it. And I think Shannon mentioned the fact that it was from 1996 to 2000, to the early 2000, a practice that was conducted when girls were 5.5 years old, and now they are 2.5 years old. So do you think that it is because they are developing the strategies to avoid further consequences? And do you think that we should talk to religious leaders in a better way? Yes, indeed. Thank you for this brief summary. So I will now move to Carolyn. We've noticed that religious leaders in the parliament, the Malian parliament, blocked the law. So do you think that their attitude will change with time? Do you think they will accept the adoption of this law? Do you think that they are more tolerant, open-minded? I think we need to talk with them. And based on the discussions we had with them, we've noticed that it's not only about religious beliefs. And we've noticed that among us activists, that it is probably a lack of political will. The Malian government should step in and take its responsibilities. We cannot say that 1% of the population agrees and 90% of the population doesn't agree. And I said it. Generally, these laws are not voted by the Malian parliament. They are actually adopted by the government, by the state. So the Malian local authorities, decision makers should step in, take their responsibilities, because it is very easy to say that cutting is not a religious requirement, but you have to use strong measures to actually give a sense to the statement. We've noticed that this is a very harmful practice. There is nothing positive about it. So that's why I think the Malian government should really be more responsible, organize awareness campaigns, support NGOs and CSOs. It's our duty to support this law. So, Carolyn, do you agree with Umu? Do you think that the government wants to change its attitude, change its position, and adopt a law? Carolyn?
Yes, actually, Umo said everything that I wanted to say, but something that I really feel it's important to say, let me just respond to what Julia said with regards to how FGM is being performed is changing. I feel like as a that is, it could also be as a result of, in the past years, messaging on FGM focusing so much on harm, the harm on health. So what we want to do now is push for the human rights approach and the gender approach, that we are not focusing on that it is a harm on girls' health only, but in addition to that, it is a violation of human rights. So as Umo has said, when we have this law, then the government will have to be proactive in the way that it promotes human rights of girls and women. So it means capacity building, awareness raising. It means funding for programs that lead to change in social norms and gender norms. And the funding is coming from the government, not only being reliant on civil society organizations work only. And also, of course, there's the component of punishment, which is as well as a form of prevention. I mean, what is it called? Like discouraging people to perform FGM or practice FGM. And then, as is it Umo or Julia had mentioned, cross-border FGM, because we're seeing a lot of cross-border FGM between Mali and its neighboring countries that have laws, for example, Burkina Faso. So that would also be a form of prevention to prevent that, but also allow governmental cooperation between Mali and other governments in the region, so that they can cooperate and work together to prevent cross-border FGM in their respective territories. So while the perception, I mean, while religious leaders are slowly changing and starting to accept that FGM is in fact not a religious requirement. And we know that there's a fatwa from Mauritania against FGM, but not all religious leaders recognize this fatwa. So we really cannot wait for everyone or to have a consensus that FGM is wrong and wait until that time so that we can have a law. No, the government needs to be more proactive in the way that it is pushing for this law, and not every time retract this provision simply because it will face opposition in parliament. So that's what Umu is saying, and that's what everyone would like to see.
Thank you very much. We have about 10 minutes left of these discussions before we take. Nous avons à peu près encore 10 minutes avant de prendre.
So we still have 10 minutes before we open the floor for more questions. I would like to ask you to answer this question. So, according to you, what are the barriers to changing religiously reinforced social norms? How can we move from this question?
So
according to you, what are the barriers to changing religiously reinforced social norms? Yes. First and foremost, I think the fact that we do not have a law against FGM is a big issue. We live in a country where women's girls and rights are not protected or less protected. Second barrier, I think, is the fact that we have social norms that are not fair to women. They encourage gender inequality. They accept that we mutilate women, prevent women to do what they want with the body. Third barrier is probably related to the social and political instability in our country. Within our NGOs, we work on areas where there are interethnic conflicts. In the past, we noticed that many villages were in favor of the abandonment of this practice, but because of conflicts, we've noticed a serious setback in the progress we've made. And I think these conflicts affect social norm change and the fight against FGMCs. So basically, we are faced with three barriers: the lack of a proper legislation, and we also have a lack of norms, real social norm changes, strategies, as well as the conflicts we have to deal with. Because when these armed people go to the field, they deconstruct all the work we've done in the past to protect women and prevent this harmful practice. Umu, what are the barriers to changing religiously reinforced social norms? And how can we change these social norms that are really, really influenced by religious beliefs? I think maybe we need to change our approaches and what we do on the field.
Les adolescents qui n'ont pas encore d'enfants et les jeunes qui n'en ont pas encore. Parce que ce que je disais la dernière fois, nous, on a déjà été excisés, on ne peut pas revenir dessus.
So I was saying last time that we have been undergone cutting, and we can come back on it. So we need to revise the legislation. Therefore, we need to lay emphasis on programming and awareness raising towards youth for the next generation. I want to highlight a certain point. It is very important that projects and programs that we implement in a country with a very difficult context like that to ensure sustainability. So it's an issue of sustainability for programs against FGMs. Because if we start a project and then we don't complete it, we will simply have to go back to square one, because social norms are anchored in the communities, and fighting against it takes a lot of years, and if they can be restored in a few months, we need to ensure sustainability of programs that we implement in in those communities. And as far as social norms are concerned, we need to communicate. We have had a lot of dialogues and we have discussed a lot. We need to implement both approaches, namely the law that criminalizes this practice and a change of behavior in order to have a solution to this problem. Julia, the government of Mali is thinking of having this law, and a law without the backing of the society will not be efficient. According to you, what are the obstacles to the change in social norms, and how can we go address those barriers? Yes, I think that laws are important, but we need there's the law needs to come at the appropriate time and start the process of behavioral change. I am not convinced that a law that is adopted at the moment where the majority of the population is not in support of what that law defends, I don't think if it will be efficient. And in the worst case scenario, it may have negative impacts, and we've seen such developments elsewhere. In Burkina Faso, for example, in our program, you see the fact that MGF or FGM are prohibited by law. There is a certain level of justice to apply or implement this law. Some efforts to implement this law. This really those who continue practicing FGM on their girls are at risk. And the family is really reluctant to practicing it because they don't want to be against the law. And I see a lot of risk. And I do agree with the fact that the government of Mali needs to strengthen their effort, but they need to receive support from social actors and different groups in order to reach a level where we have a big support from the population that can support this change, and for social norm change, we need to
Et,
focus on this aspect. And the challenge there is that our approach so far was an approach that says if people have information that they on this topic, they may change their behavior regarding that practices. But we have noted that it's not always the case, because people can change their behaviors at the individual level and continue practicing FGM. We need to find appropriate strategies in order to facilitate a change process. So the community needs to change as a whole, and it is not an individual that will change the practice and say that in our family we will not practice FGM on our daughters. So we need to think on our methodologies, on our approaches, and how we can implement a common reflection process within the community and bring them to make a decision that will be made together, not individually. Caroline, same question. What are the obstacles that need to be addressed in order to change the social norms, and how can we address those?
I mean, I will echo exactly what Julia has said, but my maybe where I will divert is that for us, I work with locality now. We feel that law is important. Like, let's start with the law criminalizing FGM, and also putting in place the law, of course, will have in place programs that the government has to implement. For example, have programs for female genital mutilation, programs that target the change of social norms and gender norms, as well as that will also guarantee funding for these programs, and also the efforts to implement the law. Maybe to touch on Burkina Faso, and also just in general how law is perceived. The perception is that when you adopt a law, it's viewed as a destination, that will solve everything, but that is not it. When you implement a law, you have to continue working with the community and also working with the people who are expected to implement these laws. For example, we've seen certain cases where, particularly in Burkina Faso, they have a very strict law on FGM, and you see that judges, instead of now giving the sentences, they're giving suspended sentences because the punishment is perceived to be too harsh. So a law was adopted, and it's been left to judicial actors to implement it, but you're also not targeting them with the sensitization messages that you're also targeting the society and the community members. So after implementation of law, you have to work with the community and continue with the programs of sensitization and also capacity building of state actors that need to implement these laws. And at the same time, you're also funding programs to end FGM, and also funding programs to build capacity of everyone in the justice chain. And then something else I need to mention is that we need to recognize that FGM is not a standalone issue. It is interconnected with various other issues in the society. So depending on context, it is important that when you recognize this intersection, don't isolate the programs that you're working on and say that, okay, we will focus only on FGM. You also have to focus on the other underlying issues, or the other issues that intersect with FGM. For example, child marriage. And then also, just to echo what Umu said about sustainability of programs, what we observe is that, particularly on the donor side, funding for female genital mutilation programs lasts maybe 1, 2, 3 years. 3 years is not enough for you to see change. 3 years is not enough to change someone's mindset. And then also, in those 3 years, it's possible that you may not see the change that you expected, because the kind of, it's like you have to report on numbers, you know, that's the kind of measure that we use for success. So we need to ensure that even as we are funding programs to end FGM, you're recognizing the fact that it will take a long time. And so you're investing long term, you're not investing short term, so that when funding ends, then what else happens? Civil society organizations in the country have to scramble to look for more funding to continue with their programs, or have to cut down the programs that they were implementing so that they can be able to, you know, continue the work that they have been doing. That is the problem that we see. And it's for that reason that I keep saying that funding has to also come from the government. It shouldn't be overly reliant on civil society organizations. And it's through having some a law and also dedicated budget within the national budget, then that we can be able to see the government coming in to step in when donor funding has reduced.
Merci Caroline. Une dernière question à vous quatre avant de passer aux questions de
A last question before giving the floor to the participants. You were talking of measures, or measurement and impacts. Do you think that your organizations are well equipped enough in terms of measurement tools? You have a YACT framework of UNICEF, which has monitoring and evaluation of social norms tool. Do your organization have these measures in place, or these tools in place? Do you have the necessary information to change the social norms? Brahima, do you think that you have measurement tools for change of norms? Do you have enough tools to measure the change of norms? Thank you. All the participants to this panel are well aware of the fact that we have tools for measurement. So we'll start with a survey on behaviors and practices that motivate communities to indulge in excision. And at the end of the program, the same community that went through the survey go through the same tools and surveys, and there we can measure where we come from. So we have these tools, we have indicators that help us to measure the change. And that helps us to implement our program. So this allows us to see if we are making progress. If not, what are the measures we need to take to correct this? And we are doing this together with the community. So we involve the community from the start in the implementation and during the program evaluation. Currently, we need a program that will last long, and a program for advocacy to adopt legislative norms that prohibit these practices. And also, we need to focus our action on factual data collection, on evidences. We need evidence of change that will show what we have obtained as outcomes and results. Thank you, Brahim. I will now give the floor to the participant because the time is going so fast. A question from Annick Newman. Thank you for all this contribution. I want to know, did you find some arguments to say that FGM is not a necessity that is supported by the Islamic religion? And what are the aspects of the religion or arguments from the Quran or the Hadith that support the health and welfare of women and children? And these arguments can be based on human rights. So are there some arguments in the religion that say that it's not necessary? And in the Quran and in Hadith, do you have positive arguments that back the health and welfare of women and children? Umu, you have written a book on this issue. What answer can you give to this question? This argument or this book has been developed by themselves. We didn't contribute. We were there for the launch of that booklet. And I think it is important that the initiative comes from them. And these are arguments that are not only Muslim, and these include Christian arguments. And this presents hadiths that say that FGM is prohibited by the Islamic religion, and it presents surat. I can share the reference after this session so that many people may have access to it. So please, you can share the link in the chat box. It will be very interesting to get that link. Brema, do you have something to add regarding this aspect? Do you have religious arguments or sacred books, argument from sacred books that go in that vein? Yeah, in addition to what Umu said regarding the religious arguments, this document was developed by a religious leader. Julia has spoken about religious leaders that are moderator. The network of these imams and scholars that defend scientific Islam. The Quran that I used that shows that in the surahs concerning women, God protects women and protects them against every form of cutting. So there are some Quranic passages that we can hear the speaker.
Dieu a grandi la femme. Donc, Dieu.
So God has laid emphasis on women.
Donc, je pense que nous
Oui.
devons.
Please, can you hear me?
Allez-y, finissez.
There are some breaks in your intervention.
Donc, je pense qu'il y a d'autres hadiths.
I think there are some other hadiths that need to be used. And I really recommend the document that Uma will share. It's very interesting and full of information. It teaches a lot of things regarding human rights, women's rights.
Le lien, dès que vous pouvez, dans le chat, ça serait vraiment.
So Uma, if you can share it.
Thank you. I wanted to remind Umu to share the link in the chat. We have another question. Is there any difference according to younger generation and older generations? Do they have different perspectives, different point of views? Julia, do you think that each generation has its own perspectives? What do you mean by point of view? Do you mean approaches, attitudes, behaviors? Yes.
Peut-être, je ne suis pas sûre.
Right then.
Légèrement, oui, je dirais. Il est souvent.
I think there are slightly different opinions, and it's easier to convince young people to adhere to new ideas. But I also think that it depends on each type of societies. And in Mali specifically, younger people do not have the last word. They cannot really change the traditional practices. You know that older people have a better position in the society. They hold the power, and that's why we want to involve the elderly, and especially grandmothers, because they play an important role in the decision-making process, especially when we talk about FGMCs. And based on our programs, it was not really what we wanted to achieve and understand. But maybe with time, we'll be able to include this perspective. But I think it could be interesting in Mali. Understand how various generations see this issue and how we can break this vicious cycle. There is a lot of work to do to end female genital mutations. We know that we should count on the participation of every stakeholders, young people, old people, and it's a generational fight. Thank you, Julia. I want to ask you this other question. What is the best approach? The religious approach or the cultural approach? Do you think that we should blend these approaches, understand the key factors and determinants, and use these approaches? Do you believe that when we use religious determinants and neglect cultural determinants could be a mistake? What do you think, Umu, about this question? Can we adopt a double approach? I think we should first and foremost understand each approach, because there is a little confusion between religious and culture. And we've noticed that all the harmful practices we want to end blend these two approaches. We should separate cultural and religious practices, especially when they're harmful. And we should also understand that good practices, as far as religious is concerned, do exist. It's very important to understand them, because I believe they will pave the way to the solutions we'll need in the future. As long as we're not able to separate religious and cultural harmful practices, we'll not be able to end these practices. We have a question for Caroline. What kind of message do you want to share when you... Oh, sorry. What message does Mali, the government of Mali, wants to share when they refuse to adopt a law? In Liberia, for instance, there is an anti-FGM law project. It was supposed to be adopted 4 years ago. So I would try to summarize it. What kind of message do you want to convey when you have a complaint, you lay a complaint against the Malian government?
So the kind of message we want to convey is that by filing, I mean, we want states to be more proactive to protect their citizens, because particularly for FGM, we see that countries tend to rely on, I mean, to use the fact that they're getting opposition from maybe religious leaders or traditional leaders. They're getting opposition against the FGM, and that is why they have not been able to adopt a law. And also the fact that it's not a large majority of the population do not believe that FGM is wrong, so they're waiting for the right time for that law to be adopted. And what we're trying to say is, no, when they signed a convention, like the Maputo Protocol and the Convention on the Elimination of All Forms of Discrimination Against Women, they were saying that they will protect the rights of women, they will respect it, and they will take all necessary measure to ensure that the human rights of women and girls are respected. And how do you do this? One of the examples is law. Another example is some of the things like capacity building, awareness raising, funding. There's so many other ways. But when you don't have a law, you basically do not have that basic protection for girls and women. So that is what we're trying to say, that they should ensure that these laws are passed, and then from there continue to work with the community to ensure that the implementation of this law, and also funding for programs, all other various approaches that they should adopt.
Est-ce que vous pensez que ça envoie un message positif et fort?
Do you think it conveys a positive and strong message in West Africa?
I think it does. It does. I mean, let me give an example. For Kenya, when in Kenya, the prohibition of FGM law was being challenged, the whole world, everyone that works on FGM was looking at Kenya to see what will happen. So the victory of activists against FGM in terms of the law upholding that, the anti-FGM law in Kenya, and saying that, okay, the government needs to actually amend the law and ensure that there is stronger protection for women and girls by prohibiting all forms of FGM, that was positive. And that positivity is the same thing that may be replicated in other countries, because some pertinent arguments were brought up in that litigation that we are seeing in other countries. For example, maybe not Mali, but Liberia and Sierra Leone, we're seeing the question of consent for adult women to go through FGM. So that was also tackled in the law. So what I'm saying is that the fact that this litigation is against Mali, it doesn't mean that no one else is watching what is happening. Everyone is watching what is happening. And so we hope that now governments will be more proactive once the judgment comes, and it's a positive judgment, that they will be more proactive to ensure that they accelerate the efforts to adopt laws in their country.
Très bien. Une des questions, c'est quel est the case title, quel est le titre?
Still, for you, Caroline, how can we really have more information on this complaint? What is the title of this case?
So the case has not the hearing has not yet taken place. That's the preliminary filings that have taken place. But I need to point out that at the moment the case has stopped because Mali has been suspended from the ECOWAS. So until that suspension has been lifted, the case cannot continue. So we're in the process of waiting and also planning the next steps forward.
Très bien, merci Caroline. Oui, c'est dommage.
Thank you very much, Caroline. Sorry, I wanted to say that Mali is still a member of the ECOWAS organization.
Yes. Yes, Mali is a member, but they have been suspended from the decision-making bodies as a result of the coup d'etat. So until that suspension has been lifted, then the case cannot continue.
Merci Caroline. Une autre question un petit peu dure.
All right, thank you, Caroline and Umu.
Quelle réaction y a-t-il au Mali?
I'm going to read another question.
Mentionne que l'excision est reconnue comme une
In Mali, how do people react when they hear that the United Nations said that FGM is a form of torture? Ibrahima, sorry, Umu, would you like to answer this question? Yes, I would like to answer this question. I think this question is slightly related to women's and girls' rights and how men understand the respect of these rights. How do we accept women's empowerment? I think this is a very, very big issue. men should really go through a process, a self-examination process. As Umu and Carolyn just mentioned, we've ratified so many conventions and protocols, and FGMs are indeed a form of torture. It is true that as far as anthropological sciences are concerned, it is not really what we mean by torture, because when a mother accepts to perform that kind of practice on her daughter, she thinks she's doing her good. But when we talk to doctors, when we talk to nurses, we clearly say that this is a form of torture, because there are a number of physical and mental consequences related to this practice. So there are such studies that clearly show that FGMs and cuttings are a form of torture, and this is true. As far as legal issues are concerned, but I think when we talk to the mothers, the grandmothers, it is not because they want to do them any harm. When we're going to take a last question, as far as the security context is concerned, as far as security in Mali is concerned, do you think that religious leaders and the government should not be pressured a lot based on the security issues Mali is facing? Do you think it's the right moment to pressure them, to pressure the Malian government and the religious leaders? Who would like to answer this question? Umu, Caroline, do you think this is the right time to do so?
Moi,
Yes, of course. Oh, sorry.
je
Please
suis
go ahead, Umu.
avec Caroline que c'est oui, actuellement toutes les couches
Yeah, I
sociales.
think Caroline and I agree that this is the right time to do so. We know that we have a full plate of issues, and everybody wants to talk about their own issues.
Les questions de violence basées sur les genres, peu importe si ces
I think
questions-là
in Mali, we want to build a new country, and we need to include FGMs.
puissent être prises en charge, et ça de façon transversale. Donc, que ce soit la transition, que ce soit le Conseil national de la transition qui fait office de parlement actuellement, c'est vraiment important que nous entamons cette discussion et qu'ils prennent les
We need to
responsabilités.
start this discussion, and they need to take their responsibility before history, because what will happen during this period will be part of history. You can continue to violate the right of women and young girls for a long time. So for every government that comes, you have the same problem. So we need to we will continue to put pressure so that we maintain this continuity. I think that will conclude the session. There are no other questions, so it is past half past the hour, so we're heading to the end.
Je ne vous entends pas. À moins qu'il y ait d'autres questions, je vais donc...
Unless there are any other questions, I think we'll conclude this webinar. I really wish to express our sincere gratitude. Yes, Prema, you have the floor. I can hear you. Yes, you have the floor, Mr. Balu. But there are some breaks in your intervention. We can hear you throughout. So I wish to express our gratitude to our panelists and the organizations that help us to develop this report.
Monsieur Ballot, ça grésille.
Mr. Balu, we have background noise from your side.
Donc, je disais que Oumou
Je disais que Oumou a bien dit et vraiment c'est la
I
conclusion.
wanted to say that Umu's intervention is the conclusion I was expecting, and we're in a context in which we need to ensure continuity. We have regional and international commitment or signed agreement at this level that protect women and young girls. So we need to respect and keep to those commitment regardless of the social cultural implications. This rights of women and young girls should be above all, and we need to continue to put pressure on the government of Mali in order to have this law adopted. That will be a conclusion, or marks a conclusion at the end of the session, that the rights of women and young girls should be ensured. I wish to thank Oumou Touré from Media Global Campaign for the redaction of this development of this report and the presentation today. I wish to thank Ren Afaka and Esosamatijo for providing interpretation. And I wish to thank you all, the participants, for your presence. We hope that this discussion has been interesting, and we are waiting for your comments and feedback in the coming days. Thank you all for supporting us in this lunch, and see you later.
Merci Julia.
Merci.
Merci Caroline. Merci Monsieur
Merci,
Ballot.
merci.
Merci, au revoir.
Et au
Merci.
revoir.
Au revoir. Thank
Merci
you.
Oumou, merci à tous. Merci Reine. Merci Esso.